While general inflation is trending slower right now, trending down, one area isn't: healthcare. And this could be one of your largest expenses in retirement. So how do you plan for it? I've got that and more coming up. My name is Mike Bernard. I'm the host of the Wise Money Show. I'm also one of the certified financial planners right here at Korhorn Financial Group. Make sure you hit that subscribe button, turn on notifications, and smash that thumbs up button. When you think of the biggest expenses that you're going to have, that you're going to face in retirement, healthcare expenses or health insurance is right up there, right? It's many people expect it's going to be their highest expense in retirement. I can tell you it's definitely going to be in the top three. If you don't plan well for taxes, taxes are likely to be your biggest expense in retirement. A lot of data shows that housing expenses are actually one of the largest expenses, and then right up there is health insurance. Well, here's the problem. Health insurance or healthcare costs are outpacing inflation significantly over the past decade, and they're projected to continue to outpace inflation out there in the future. So how do you plan ahead with health insurance expenses already being one of your biggest expenses in retirement is growing at an even faster rate? This is one of my big gripes with online retirement calculators. I mean, number one, when you retire and how you retire, this is one of the biggest financial decisions we're all going to make. Do you really want to base all of that big decision, on just an online calculator that's quick and easy and probably has a lot of garbage in and therefore garbage out? One of my big gripes with these online calculators is you input really basic information and it spits out a retirement suggestion or some sort of confidence rate. Well, one of those basic things that you input is, what's your income right now? And they assume that, well, you're probably going to want to spend 75% or 70% or 80%, somewhere around there, of your pre-retirement income. Here's the problem with that. That is completely disconnected from what healthcare is going to cost in retirement. In fact, if it assumes, if your retirement planning or the financial advisor that's helping you with planning your retirement is not isolating health insurance as its own, or healthcare as its own separate expense and applying its own inflation rate to that, likely you're underpreparing and it could threaten your entire retirement plan. Historical trends going back over the past several decades shows that healthcare costs tend to increase on average about 1.7% above inflation. It tends to move in the same general pattern as inflation, and of course that's over a long period of time, so there's certainly going to be time periods when it doesn't. However, the rate of change, healthcare costs tend to rise in value, increase in price about 1.7% above the typical inflation or just general inflation. That means if we're seeing between 2 and 3% normal inflation, then you should expect your healthcare costs in retirement to rise somewhere about 2% above that, 4 to 5% in total. And if you're not specifically planning for that as you're building out your retirement projection and retirement plan, you're under planning, you're under preparing, and you're getting a result from that retirement plan that isn't helpful and that isn't going to get you to a confident retirement. What should you do instead? As you build out that 5-factor retirement plan that factors in the age that you're going to retire as well as your life expectancy, retirement spending, retirement income, how much you have saved up for retirement, and your risk tolerance on those investments, retirement spending, health care needs to be a separate line item in that retirement spending. Why? Because when it's a separate line item, you can then apply a separate inflation component as well. Guys, for 20 some years, how we do our planning here and those 5 factors is we assume a base rate of retirement lifestyle, of retirement expenses, then any one-time expenses, annual vacation or weddings for kids or that sort of thing. But then in addition to that, we factor out a separate line item for health insurance, for healthcare costs, and we assign an inflation rate of around 5% to those healthcare costs, both while you're during your career, but also into the retirement years as well. By the way, we also factor in actual taxes into that as well, so that is being a mock tax return is being created every single year of retirement to specify, well, what do we think how much will be going towards taxes in any given year. This isolating this variable and applying a a different or a higher inflation expectation helps you plan ahead for what we've really seen as the trend over the past several decades, but certainly over the past couple of years. So taking this approach will help you plan ahead and be prepared just in case healthcare costs continue to rise at an accelerated rate out there in the future, which I don't see any sign of this stopping. I'm certainly hoping that it does. But in addition to planning for that in your 5-factor retirement plan, do a couple of other things as well. One, make sure that you're working with a health insurance expert that is a specialist in Medicare and Medicare options, and ensure that they're collaborating with your CFP. I mentioned that retiring is one of the biggest financial decisions that you're going to make in your life. One of the other ones is deciding what version of Medicare to take. Traditional Medicare, which is Medicare Part A, B, D, and a supplement plan, or Medicare Advantage or Medicare Part C. You're going to want to work with a Medicare specialist early on so that you get the education, you understand the differences in those approach and what your options are so that you can know what's best for you, and then ensuring that your CFP is collaborating with you and that Medicare specialist so that you make the best decision. Also, if you have a qualifying high deductible health plan during your career, really optimizing that HSA, contributing as much as you possibly can, and building that account balance up to potentially be another retirement resource for you. If healthcare costs continue to rise at an accelerated rate, having an additional nest egg and an HSA to help you cover those medical expenses will help you prepare as well. And then lastly, having a plan for how you're going to manage the long-term care risk. Studies have shown that people will spend, and a married couple will spend on average around $300,000 on healthcare in retirement. And that typically doesn't include a nursing home or assisted living or some long-term care expenses. So having a plan to manage that long-term care risk, which most health insurances really don't cover or don't adequately cover nursing homes or long-term stays in assisted living or custodial care. Typically, that's not covered by health insurance. So working with your certified financial planner to build out a plan to manage that long-term care risk is another thing that you need to manage with your CFP. Build out that health insurance as an expense with a higher inflation rate as part of your 5-factor retirement plan, and work with your CFP on those additional 3 tips as well. If you don't have a CFP on your team, you can contact one of my team. Find us online, Korhorn.com. That's Korhorn with K, wisemoneyshow.com. You can find us there as well, or give us a call, 574-247-5898. All right, there you have it. Go out and take your next wise step in your financial life.